Post-operative instructions, dental implants. Do not disturb the wound. Avoid rinsing, spitting, or touching the wound on the day of surgery. There may be a metal healing abutment protruding through the gingival gum tissue. Bleeding. Some bleeding or redness in the saliva is normal for 24 hours. Excessive bleeding. Your mouth fills up rapidly with blood, can be controlled by biting on a gauze pad placed directly on the bleeding wound for 30 minutes. Discontinue the gauze pads when the bleeding stops. If bleeding continues, please call for further instructions. Swelling. To minimize swelling, apply an ice bag, a plastic bag, or a towel filled with ice on the cheek over the area of surgery. Apply the ice for 30 minutes on and 30 minutes off for the first 36 hours. Diet. Drink plenty of fluids. Avoid hot liquids or food. Soft foods and liquids should be eaten on the day of surgery. During the first 2 weeks, continue to follow a relatively soft diet. Make every effort to avoid chewing directly over the implant sites until advised by your surgeon. Pain. Discomfort after oral surgery is normal. To best manage your discomfort, please take the prescribed pain medications on schedule per the directions provided. Staying on top of a regular schedule will best minimize discomfort after oral surgery. If you are still experiencing significant discomfort despite the medications, please contact our office. Antibiotics. Be sure to take the prescribed antibiotics as directed to help prevent infection. Oral hygiene. Good oral hygiene is essential to good healing. The night of surgery, no rinsing is needed. 48 hours after surgery, the Paradex should be used twice daily after waking up in the morning and before bed. Be sure to gently swish for at least 30 seconds before gently spitting it out. Warm saltwater rinses should be used in addition to twice-a-day Paradex rinses. 1 teaspoon of salt dissolved in an 8-ounce cup of warm water, especially after meals. Brushing your teeth and the healing abutments is fine. However, avoid brushing directly over sutures until they have dissolved on their own. Be gentle initially with brushing the surgical areas. Activity. Keep physical activities to a minimum immediately following surgery. If you are considering exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. Wearing your prosthesis. Partial dentures, flippers, or full dentures should not be used immediately after surgery until they have been adjusted by the doctor, unless otherwise instructed. This was discussed in the preoperative consultation. Please note, telephone calls for narcotic, painkiller prescriptions renewal are only accepted during office hours.